The two main programs I was going to talk about today are MPharm and MPharm with International Year Zero. These, of course, are really based on a profession, so becoming a pharmacist. And the main areas our graduates go into are obviously community and hospital, particularly in the UK and in some other countries now as well. There's a lot more opportunity in GP practice. And by the time our graduates come through, we're really looking towards preparing them for independent prescribing and working at a high kind of clinical level within those industries. We do get some who go into industrial pharmacy. But as I said, I think PCS is probably a better route for that. And a lot of academic pharmacists go via this route as well. And people can also work in things like the military, NHS, private sector, or go on to, of course, to postgraduate or research study. So in terms of studying pharmacy here at DMU, yes, we've been here a long time. We're well established. We have some great integrated work placements and good relationships with the placement providers here in Leicester. All of the placements that the students need to complete the degree are included within the programme, and they're all very local. You can normally just get on there. We've got like a hospital hopper bus that goes around the hospitals, and they can use that to get to their placements. And when they're in community, if they're not within the city, they're normally very, very close. The students normally either get the bus or sometimes they join together, get an Uber or a taxi, etc. We've also got some great volunteering opportunities, and some of our students have really got involved with things like cancer care and diabetes support for local people within the city. Within the pharmacy degree, everything is very integrated. There's a lot of blending between science and practice. So we tend to work around kind of drugs or themes. We have up the side here all these yellow modules. These are all portfolios. That's very much kind of reflective skills on practice and placements, calculations, experience. And these are the core modules in the middle here. So we have 2 core modules every year. In the first year, we have Introduction to Pharmacy. That's what I like to think it's all about, the outy bits of the body. So it's skin, ear, nose, throat. We look at the drugs that act on those areas and the infections or the disorders or diseases. And we link all of that together with the chemistry and biology right from the beginning. So it's really been designed to be very blended right from the start of the course between practice and the science. And the other big module we've got in the first year is GI tract and nutrition. So that's all the innie bits. It's all about the stomach, all those kind of things. So it would be more oral dosage forms, and that would be things like tablets, syrups, suspensions, things that you swallow. So we use those examples. Then we would build on that all through the programme. So I teach a lot as well on infection and immunity here. Then we move on in the third year to more about cancer and personalised medicine. And in the final year, it's very much about total patient care, maybe patients with lots of different conditions on many different medicines and how we would manage those. So just to give you an idea of the themes, there are 4 main themes of the first year of the course, and I'll just do these very briefly to give you an idea of what kind of things we cover. So in the first year, it's very much focused on the origin and chemistry of drugs. That's theme 1. So where are the drugs coming from? How do they work? The second theme is all about preparing medicines. So how are they combined into something that the patient can take and it actually works properly in the body and then it's absorbed, etc. The third theme is all about action and uses of drugs and medicines. So that's things like microbiology, that's my subject, pathology, so study of disease, pharmacology, how drugs act on the body. And this then really links in with the clinical uses of the medicines in patients. And the final theme that runs through every year is pharmacy practice. So this looks at medicine supply, the advisory roles, the laws and standards, which are very important around pharmacy. And it's helping them to prepare the students for responding to patient symptoms, how to promote healthy lifestyles, and very important, how to advise other healthcare professionals, carers, patients on all aspects of medicine's usage. And that's a very big part of the pharmacist role. So as well as teaching within the department, of course, we are a research active university. We've got some great projects going on. I work very closely with Catherine Huddersman, and I'm in the very glamorous area of wastewater treatment at the moment. So I look at, we produced a product that enhances the disinfection of wastewater, but is also used for medical applications too. This is my colleague Katie. She was particularly interested in education and hand washing, and she's written some children books that have been translated into other languages and are used for educational purposes. So when I do the open days, we get asked a lot, so by the applicants, how am I going to be taught? How am I going to be assessed? So we use a variety of different learning methods. Lectures, which of course at the moment are all online, either pre-recorded or a bit like this, more of a webcast kind of style. We probably will retain some of more of our blended learning in terms of the lectures for next year, but the plan next year, hopefully, government regulations notwithstanding, that we will go back face to face for everything else. So the other things that we do, a lot of case study work, group work, large number of laboratory classes, which the students really enjoy. And particularly on pharmacy, we have these things called interprofessional workshops. This is where the students get together with students from other courses. So we work with Leicester Medical School at Leicester University, just up the road, and meet their medical students so they can exchange knowledge and views. We work with our midwives, with our social work students, and also with our nurses, audiologists, etc., to think about the patient from our different perspectives. In terms of assessment, the students are assessed through multiple choice exams on pharmacy, but they also have something called OSCEs. That's like a practical exam. So there are different forms. Some of them might be to do with dispensing, which is all about the legal kind of use of medicines and how we give them to the patient, make sure it's correct. But the ones I think are most fun are the role plays. So we're still doing these at the moment, and I might come in and go, oh, I've got this bit of a problem. Look, I've taken a picture on my phone. Can I have some Dactarin for my athlete's foot or over the counter? And you as the student then would have to draw that information out of me. So you'd have to say, oh, well, is this for you? How long have you had this condition? Do you have any other underlying health conditions? What are the main signs and symptoms? Do you have any allergies? What other medication are you taking? And by taking that patient history, they then need to make a clinical decision about what to do. So we do practices of these, and then we do them as examinations as well. I think the students really enjoy it, find it very useful, because it's much more a replication of what they will actually do when they go into practice. So they might at the end say, oh yeah, it's fine, here's some athlete's foot powder, or cream, you can have that over the counter, I can just sell that to you now. Or they might need to have more of a consultation with you in the private consultation room. They might need to refer you to your GP, or perhaps if they thought it was very serious, to the hospital. So maybe they think I have diabetes and I have a foot ulcer or something like this instead that's got infected. As well as OSCEs, we have, of course, written coursework, and that can take lots of different forms. So it could be posters, presentations, scientific write-ups, lots of different ways they're assessed.